The next topic, or a specific topic that we will be discussing is cancer of the breast. So breast cancer is this is a abnormal cell growth of this abnormal cell growth at the breast tissues, no? So this is the most common. This is the most common cancer in women. Okay, cancer in women. So again, it's a abnormal cell growth. The breast tissues. Okay. So guys, so the risk factors for this, the causes. Actually, we have we have modifiable and non-modifiable causes or risk factors. So you have your causes, risk factors. So you have syempre first, makes a risk if syempre you are a female, diba? Syempre if you're a female, syempre female, age 50, no? Age of 50, 50 years old. Ano pa ba? 50 years old. If you have a family history, that puts you at a higher risk, no? If you have a family history, halimbawa, history of your mother, grandmother, yan. So you need to see your doctor, especially if you're already at your 30s or your 40s, because again, sabi nga, the earliest, the standard, no, age for a woman or a woman to start checking for breast cancer is at age 40, no? So age 40. So you have to be screened at age 40. Okay? That's the average, yung risk ng female or woman sa breast cancer. So syempre it puts you at higher risk, sabi ko nga, if you have a family history. So like a first degree, no? Like ito, mother mo or grandmother, so definitely you need to be checked. So as early as 30 years old, no? 30 years old, some recommends earlier, no? Pero ito nga, so the average would be 40. So if you are at a higher risk, so it will be 30 years old, 30 to 35 years old. So paanong pansagot sa test niya? So we go to the basic or the most common. It's age 40, no? Kasi kung pansagot sa test yan for exams, it would be age 40, no? And every after 2 years until at age 70 plus years old, no? Then every 2 years, no? So yun yung recommendation. And every 2 years. So sorry, pangit. So and every 2 years until age 70 plus, no? So yan yung atin for. So what puts you at risk pa, no? What puts you at risk? So again, if you have a personal history, you had a previous cancer, na you have a, sabihin natin, you have a ovarian, or you have a uterine cancer, so that puts you at risk, no? So history history of cancer, no? Such as sabi natin, ay, electric fan. Yeah. So, cancer, you have your ovarian, so ovarian and endometrial or uterine cancer. So that, and ano pa, you have a genetic mutation, pero actually that's already for that is the mutation for breast cancer, no? Kasi again, breast cancer is one of the cancers that is heavily linked to genetics, no? So when you see breast cancer, you always think it's hereditary or genetics, no? So let's put it here. So heavily linked to genetics, no? Kaya nga, if you see your one of their risk factors are being you have a family history, a first degree, puts you at higher risk, no? So genetics, hereditary ang link niya. And sabi dito natin is yung genetic mutation that is associated with breast cancer and ovarian cancer would be BRCA1 and 2, no? BRCA1 and 2. Yan yung mutation nila. Pagdating naman sa other example would be if sa colorectal cancer, you have colorectal cancer, it's the Lynch syndrome, no? Sa Lynch syndrome. Mamaya I'll explain a little about that, no? But I've already explained that to the other videos that I had, no? So for you guys, no? So ayan, so history of cancer, then again BRCA1 and 2 mutation as I've mentioned. So that's the causes. So if I'm gonna place here again, this one is the this is the non-modifiable risk factors, no? If this is a modifiable risk factors, so like the general risk factors, no, for cancer, so you have your modifiable. Okay, so babalik lang tayo dun sa tawag nito sa general signs and symptoms. Kasi sabi ko nga before, no matter what type of cancer it is, no, it all ends up with one word at the last part. It's always cancer, no? So you just go back to the basics, and when you see the causes or the risk factors of cancer, laging at the top of that is at the top of that will always be your smoking. You have your alcohol, diba? So smoking will be a risk. Alcohol will be a risk, no? So pero syempre if we relate it to the for women, so syempre number one dito is this will go last, no, si smoking and alcohol. So number one dito is being you being overweight, no? You being overweight. So there is a inactivity. So you have inactivity. So pangit ang lifestyle. Anyway, I'm gonna put here yung lifestyle, no? So lagyan natin dito siguro green kasi lifestyle, no? Green kasi lifestyle. Ay, sorry. So gonna put here like green. So lifestyle. Okay, lifestyle. So ayan, so lifestyle. So inactivity, this causes obesity. So we have it. We have obesity. So a BMI of more than 30. So it's your obesity. Tapos exposure to prolonged exposure to estrogen, no? So prolonged exposure to exposure to estrogen. So, wag kalimutan. So, ano yung mga examples na ito, no? So, kaya sa test, if you see yung halimbawa, what puts you at risk sa cancer, sabihin natin you see use of contraceptive pills. Yes, definitely yes. Contraceptive pills or hormonal contraceptives, yan ang nakalagay din doon. You have sabi natin ano pa, early menarche, yung aga ng menstruate, no? So early menarche, does this put you at risk? Definitely yes. How about late menopausal? Yes, definitely yes, menopausal. So yan puts at risk pero I did not say na yan ang magiging cause. So this is a risk factor. So any of the risk factors can technically be the cause of your cancer. Okay? So ano pa? What's a bad thing about our lifestyle? Number one is our diet, no? Diet. So kaya nga diet, diba, you eat too much fat, and then less fiber, diba? Less fiber. So ugaya ng ano din, if you eat too much red meat, that puts you at risk with cancer, especially colon cancer. Yan. So ito, if you do not eat too much fruits or not much fruits or vegetables. So alam naman natin na si fruits and vegetables has this phytochemicals, no, to get rid or fight or prevent cancer, no. So yun yung magaganda sa fruits and vegetables. Meron tong yung antioxidants, 'di ba? So this is good for our body. This prevents cancer. So fat, fiber, no? So yan, alcohol is nasa taas na, in smoking, no? Kaya nga dito, ito ang madali. Sabi nga natin, we can get to answer it agad. So it's easy. When you see smoking, what do we do as a management or teaching? So syempre we teach our client to cease from smoking, no? So stop it, no? Cease from smoking. So you just stop it, no? Kasi this is a risk, no? It's a risk factor. Alcohol, we aside from liver cirrhosis, no, na we tell our patients to stop taking alcohol. So we can limit alcohol intake, no? We can limit alcohol intake into 2 drinks per day, no? So we have to limit to 2 drinks per day. So yan yung mga education and teachings. So tingnan nyo, always just do it vice versa, no? If this is a cause, you would want to reverse the cause, no? Kasi minsan we are making it really hard for ourselves, pero hindi naman siya mahirap. O tingnan nyo dito, sabi our risk is inactivity. And so what do? You be active. O diba, parang tanga lang, diba? So you be active. So yun ang sagot doon, you be active. Walang science dun, diba? Babalik rin mo yan. Oh, like this one, sabi if it's a cause or a risk is being obese, and what do? You lose weight. Definitely you have to lose weight. Okay? So ito yung wala tayong actually magagawa ng gusto. Kasi sabi dito, contraceptive pills, pills, no? Contraceptive pills or hormonal contraceptives, definitely meron. Kaya nga that's why we always consult our physician or your physician, no, before you take any kind of pills, no. So ayan. So halimbawa early menarche. So may magagawa ba tayo with the comes to early menarche? Well, syempre wala. 'di ba? So it puts you at risk. So anong magiging maganda sa mga ganitong um ano risk factors? Eh syempre ito na yung how is this tested sa exams. Syempre this is more on prevention, no? This will come out as a question of prevention, no? 'Di ba? It's a question on prevention kasi you are at high risk, no? Question on prevention, 'di ba? Prevention, question on um, health promotion, no? 'Di ba? So health promotion. Okay? So paano tayo makakalayo, no? Kasi at risk na tayo. Paano tayo hindi magkakaroon? Kasi at risk na tayo. So ganun 'yan. You just have to reverse everything, no? So again, you see here, high fat, low fiber, definitely proper diet, 'di ba? So yun. Ibig sabihin ng proper diet is a must, no? Proper, balanced, 'di ba? Balanced diet. So yan lang yan, no? When it comes to the modifiable risk factors, 'di ba? So again, wala tayong magagawa doon sa non-modifiable risk factors. Pero again, paano rin siya iti-test sa non-modifiable risk factors? Edi again, how is it tested? Prevention, no? Prevention. We promote health, no? So ganun ang gagawin natin. So that is what you look for sa test, kung paano ang approach. Okay? So ganun. And then oh fuck, my god, been talking to oh my I'm sorry, diba? So again, what happened to my okay, so continue. So the fuck, so I can't continue with the video because yun, naubos na yung yung storage. Oh my. So anyway, so sige. So ito na, no? So with your breast. So paano ba? So ngayon early. So sabi ko, na-interrupt tuloy ako. So sabi ko 40 years old, no? Sabi ko na to, this is the where you female or yung mga women as is at risk for breast cancer, no? So yun yung ayaw natin. So dapat we have to already be screened for breast cancer. So saka before pa naman meron tayong what we call your self breast examination. So during that self breast examination, we are taught to what? To look for lumps. Kaya nga 'di ba? So pag when it comes to patient teaching, so I'm gonna write here patient teaching or education. So ano kayang color pinakamaganda? Sige, ito na lang kasi walang nakapalibot na other colors, no? So we put here patient teaching or education. So patient teaching. So when it comes to detecting breast cancer, teaching education. So teaching education. So what are the signs and symptoms ng breast cancer? Kaya nga 'di ba sabi natin before dun sa mga general signs and symptoms ng cancer is meron doon we say na if there is a lump, yan 'di ba, lump that does not go away. So in instance sa breast cancer, 'di ba, before your menstruation, nafi-feel nyo na, di ba, there is a lump sa breast. No, there is a lump sa breast. Tapos pag ginahawakan nyo, it's painful, no? So tapos pag tinitingnan nyo, minumove nyo, it moves, no? It moves with the skin. So ganun yan. Pero dito, you see that the lump does not go away. Does not go away. Anong ibig sabihin? Tapos na yung menstruation nyo, nandun pa din yung lump or nandun pa yung bukol. So means that is actually one sign that you have a growth na nandoon, naka-attach mismo sa tissue. Okay? So ganun yan. Kaya nga, yung description ko kanina, yung pag it's a normal na lump, no, when kapag during menstruation and before near menstruation, di ba, it's painful kapag inaano nyo, you press it, it's painful. Pero kapag sa lump sa breast cancer, it is often hard, it is irregular, and it's painless. So yun, lalagay natin dito. It's hard, it's irregular, and it is painless. So ganun yan, it's painless. Tapos aside from your breast, no, so yung lump nyo extends saan? Sa may kilikili, no, sa may underarm, no, sa may armpit, no. So under that, kasi you know what, there are a lot of what of lymph nodes there, no. Tapos minsan yan, cancer starts doon sa underarm na yon. You see, so ganun yan. So there is a swelling, 'di ba? So you'll feel sa breast, okay? Saan? Sa breast and sa may underarm. So doon yung presence ng swelling or yung pamamaga. Okay? Swelling or thickening. Yan, doon nyo siya nakikita. Okay? So syempre there is a change in there is a actual change in the shape and the size, no. So ganon, change in the shape, okay, and size, no, size ng breast nyo, no. So size ng breast nyo, even the appearance, no. So even the appearance, no. So there will be some change. So gaya nga doon, yung sabi nga natin na there will be like ano yung mga changes na yun, no, there will be like, sabi natin, there will be dimpling. Okay, so yung sinasabi natin, it looks like a orange, 'di ba, yung orange peel, no. So ganun yan. So meron tayong dimpling, you'd see dimpling, merong redness, 'di ba, you have that redness. Tapos yung the orange or the orange, 'di ba, sabi natin dito is the orange na peel, na yung nakita niyo yung peel na yung balat ng orange, tapos may mga lubog-lubog, yan, ganun, tapos kulay orange pa. So it's like that, no, yung breast, no, kapag meron cancer. Okay, tapos you have a nipple that is inverted. So inverted nipple. So yan, you have a inverted nipple, no. So ano pa, aside from that, tawag nito, there is a presence of a discharge, no. So a presence of a discharge. Okay, so it's bloody, or it is even clear, no. It can be bloody and it can be clear, no. Yung discharge can be bloody, okay, or clear. Okay, so ganun yan. Then syempre there is actual pain that they feel, no. So there is pain that they feel. So Ganun naman si cancer mostly, 'di ba? There is always a pain involved. Then you have a tawag nito, um, swollen lymph nodes, no? There will be a swollen lymph nodes. Okay? So, yun ang makikita natin. You have a swollen lymph nodes. Okay? So, huwag niyo siyang kakalimutan, no? So, those are all signs, no, that you have a that you have a breast cancer. So you have to aware of all that signs, no? That's what we teach to our client, no? So kaya nga again, so yung screening is very important. So ano yung what do you call that procedure that we do, a diagnostic procedure that we do to detect, no, cancer. It's a diagnostic procedure. So it's called your what? It's called your mammogram, no? Diagnostic procedure. So 1%. Okay, so it's your mammogram. Okay, do your mammogram. Okay, so at 40, no, and every 2 years until you are 79 years old, no. So mammogram. So ganun. Before, this is painful, no, just like my mother, no, before pag nagmamammogram yan, pero wala naman breast cancer si mama ko. Pero before, pag nagmamammogram siya, she always complains of pain pag nagmamammogram. Now hindi na, kasi meron na tayong digital mammogram, no. So ibig sabihin, it's hindi na ini-squeeze yung breast nila, no, kasi before ini-squeeze in between the machine, no. So ganun ang ginagawa before. So ngayon it's actually painless na. So mammogram is really advised, no. Okay, so ganun. So pag higher ang risk mo, this is done every year, no. This is recommended, this done every year. So for the for the hindi naman talaga at risk or at higher risk, this is done every 2 years, no. So ganun yan. So we have a question. So ito, so what is the most common symptom of breast cancer? So A, breast pain, B, nipple discharge, C, a new lump or mass, and D, skin redness. So the correct answer would be, it's letter C. So this is a palpable lump, no. This is the most frequent presenting sign, no. Though many lumps are benign, sabi nga natin, maraming benign, pero this is the earliest that is reported, no. So ganon, laging may nafi-feel silang matigas, no, or bukol. So it prompted them to go for a consult. So ganun yan, no. So it's the correct answer is letter C. So another question. Okay, so another question. So what is a modifiable risk factor? So A, BRCA mutation, letter B, alcohol consumption, C, age, and D, family history. So pretty obvious, right? So pretty obvious. It's actually, the correct answer would be letter B. Sorry, actually correct answer would be letter B. No, it's alcohol consumption. You have to decrease it, no, at least 2 drinks per day. 2 drinks per day. So that's the answer. Okay, so again, let's the next question. When can an average risk women optionally start annual mammograms? So A, B, C, or D, what's the correct answer? So the correct answer would be definitely kakatapos lang nung yung topic yung topic na yun, it's actually 40 years of age. So they can start a annual, no, a annual mammograms, no. So at 40 years of age. Sabi natin they can start as early if mataas ang risk nila. They have a family history, especially if it's first degree relatives, no. So they can start as early as age 30 to 35 years old, no. So pwede yan. So for the average risk lang is we start at 40 to 44 years old, then every year after that, or every 1 to 2 years, so depending on the recommendation of your physician. But the most common would be after that it would be every 1 to 2 years. Okay, so that's your mammogram. Okay, so after a suspicious finding, syempre, limbawa after a diagnostic mammogram, you have your self breast examination, and then you are actually checked by your physician, no. So there will be what are the next procedures, no. So anong pwede nilang gawin next? So pwede na sila magano, halimbawa there is a presence, sabi natin there is a presence of a lump, no. Tapos after a mammogram, nandun talaga yung lump. It's a growth, no. It's hard, nandun sa tissue, it's connected to the tissue. So what's the next procedure we have to do? Diba sabi ko nga sa inyo before sa start natin, kapag lump, kaya nga diba cancer, they grow and they grow. So after that, mandatory, anong gagawin talaga nila doon? So to know, it's your biopsy, no. So ganun ang gagawin. The next thing to do will be a biopsy. Okay, it's a biopsy. Ito darker na lang kung makapag-decide what color, no. So it's biopsy. So the next thing to do is you do your biopsy, no? So it's a breast biopsy. So do a breast biopsy so that we would know if what type or what kind of growth is this, no. So sabi nga natin, it is where the hardest part is to wait, kasi dito this is the one that you would wait for the result if it is a benign tumor, diba? It's a benign tumor, or if this is a malignant tumor. So sabi ko before, this will be the worst, no. Either days of the women's life, or this would be a days or week, no. So grabe naman kung weeks aabutin yung biopsy result niya, no. So ganun yan. So sabi ko dito, if remember, diba, this is where family members are needed, friends are needed, no, support systems are needed, no, kasi this is the time that your patient is at risk, diba, they have anxiety, no. So dito yan, they have anxiety, they have depression. So they really need us support system, no. So wag natin kakalimutan yan. So ayan, so ano pa yung pwedeng ipagawa? So we would be checking for their tumor markers, no. So pwedeng ipa-check yung tinatawag na HER natin, no, yung HER. Okay, so gonna put the HER, yung HER, no, yung hormone receptor tests. Okay, so yan, hormone receptor test, no, receptor test. So ganun yan. So if yung tumor, it uses ba estrogen, progesterone to grow. So ganun yan, no. So dun natin inaalam, okay, para you would know, or the physician would know on what therapy to use. Kasi if the cancer uses, sabihin na natin if the cancer uses estrogen, or progesterone na progesterone to grow, o di ba, we will be using a hormone or hormonal therapy, no, as one of their treatments, no. So again, sabi natin, progesterone, okay, to grow, yan. Then probably you would know yung there will be a very positive response to hormonal therapy. So ang gagamitin nila dito, if they find out, so definitely will be using a hormonal therapy. Siguro if you've heard about yung tinatawag nating yung tamoxifen, no? Tamoxifen. So it is a hormonal therapy. So this prevents cancer, no? So this prevents specifically your breast cancer, no? So ganun yan. So then we can they can do also sa diagnostics, no? Sa labs, they can do your HER2 test, no? Meron tayong isa pang no? HER2 test. So anong gagawin dito? They actually measure yung protein gene, no? Ito nga yung protein gene, yung overexpression, ito yung genetic mutation, no? So para alam natin kung positive ito dito, then definitely your healthcare providers can easily, no, know what kind of chemo or what kind of treatment to use, no? So ganun yan, HER2 test, no? So you have your tumor markers, 'di ba? Sabi natin is before, what did I tell you sa tumor markers, no? Tawag nito yung CA153. Yun yan, 'di ba? It's your tumor markers. No? The chair's making me uncomfortable. Kaya sorry. Naupuan to. So ayan, 'di ba? So pag all are pag it is really positive na merong ang patient natin cancer. So syempre what is the management? So the management will be very very easy to remember, kasi it's the management for all, 'di ba? So sabi natin is management would be aside for the medications, no? So we have the standard radiotherapy. Okay, you can do your radiotherapy. You can do your chemotherapy. Okay, you have your the hormonal therapy. You can do your hormonal therapy and immunotherapy. So those are immunotherapy. So that's how you manage your breast cancer. Pero again, nothing beats the old-fashioned surgery, no? Old-fashioned surgery. Okay, so the surgery is your mastectomy, diba? We have the mastectomy. So we have your mastectomy. So we call it mastectomy. But in other countries, mastectomy, they lose the T. You have to lose the T. Mastectomy here, no? Sa other countries, they'd say mastectomy. So we might not understand. So they just lose. You just have to lose the T when you're in other countries. Okay, so ganun yan. So we have different type of your surgery, no? So we have, ngayon meron na tayong tinatawag na specific, no? Specific lang na we would want to remove, like ano ba, you have your lumpectomy, you just remove the tumor. Okay, so saka yung involved lang, then they put a margin there ng a little ng healthy tissues para may margin in between the tumor and the affected site, or the one that was reached by the tumor, and then a space a space between them doon sa mga no tumor at all, yung mga healthy tissues natin. Okay, so ganun yan. So ganun yan. So this actually preserves yung yung most breast, no? So then we go to the classic. Ito na si mastectomy talaga, no? Ito na yung si mastectomy nyo. So this is your mastectomy. Okay, mastectomy. Yan. So this is already a complete. Okay, this is already a complete removal, no? This is a complete removal. Okay, sorry, complete removal, sorry for that. Okay, no, of the breast, no, removal of the breast. Kaya nga dito it's already ito yung when they do this, actually you need a reconstructive, no, or reconstructive surgery. Okay, so ganun, kasi dito you actually remove the tissue, no. So ito, kung ilalagay ko, you remove the tissue. Okay, skin, the nipple, and actually your areola, no. So tanggal yun siya. So that's what that is what the total mastectomy procedure is. So but this only spares most of your lymph nodes, no. So may natitirang sila, yung alos natitira is your lymph nodes. So kaya pag tiningnan mo guys, yung mastectomy na procedure, meron tayong tinatawag na modified radical mastectomy. So yan, modified. Okay, so modified radical mastectomy. Okay, so mastectomy. So just worried about the time kasi ang problema is when I upload it, it's too huge, no? So tagal mag-upload. So modified radical mastectomy. So ano to si modified radical mastectomy naman? Okay, ito yung they remove the whole breast, may plus yung underarm, yung lymph nodes nyo sa ilalim ng kilikili, no, sa may axilla, no. So kasama siya. So lagay ko yan dito. You remove the breast. Okay, so you removes the whole breast, okay, and the lymph nodes, okay, and the lymph nodes, sorry. So, and the lymph nodes, okay, and the lymph nodes under the axilla. Yan. So ganun ang mangyayari nito. So sa tinatawag nating modified radical mastectomy. So kasi again sa ilalim nun, pag breast dun talaga papunta yan mostly sa breast cancer. So ano pa, we have your skin sparing mastectomy. Okay, so dito naman they remove lang yung yung breast tissue. Okay, ganun ang ginagawa, and they keep most of the skin intact, most lang of the skin intact for reconstruction, so para yung skin envelope nandun pa din siya, kaya pag nakita niyan nakalawlaw na skin lang, so kasi yan, iniwan talaga yan for reconstruction. So gagawin pang para kung maglalagay gagawing breast. So ayan, so yun ang ginagawa niyan. And then meron pa tayong what we call yung other procedure na nipple sparing mastectomy. So yan. So nipple sparing mastectomy. Mastectomy or mastectomy. So ganun yan. So okay, so malamang hindi naman na tayo aabot sa mga yan. So definitely the most important would be your mastectomy, your modified radical mastectomy. Okay, so and it is also good to know that you have a skin sparing mastectomy for reconstruction. Okay, so now post surgery, let's talk about syempre post surgery. Sige, lagay natin dito post surgery. So post surgery, yan. So what do we see post operatively, pag balik na ng patient sa room, so usually ang patient has a blood drainage, meron silang blood drainage. Okay, so they have a blood drainage, they have a blood drainage. So this blood drainage is often, if you've already heard about it, so that is what we call your Jackson Pratt. Okay, so Jackson Pratt, have you heard about it sa hospital kapag nagjo-duty kayo? So yung ganun yan, so ito yan, Jackson Pratt bulb, double T, bulb. So hindi nyo pa nakita yon. So ganito yun actually yung itsura nun. Diba, if this is yung person, okay, tapos yan, katawan niya, yan, so okay, so ganito, tapos halimbawa ito yung breast niya, tapos ito yung tinanggalan. Okay, so yan, tinanggalan, tapos meron dyan drainage under that, so nandito yan mostly sa part na yan nakalagay. Okay, dyan sa part na yan, kasi syempre sa ilalim sasaluhin, kaya nasa ilalim yan para it's easier to drain, say it's fluid that you would drain. So it's a Jackson Pratt, so meron yan siyang bulb, ganun yan, bulb, parang granada, kala nyo granada talaga, so ganyan yan. So this one, ito yung hini-squeeze, pwede naka-squeeze yan, so naka-squeeze, pag nakita nyo yan, pag linabas yan naka-squeeze. Bakit? Para ma-squeeze niya yung naandun sa loob, lalabas siya papunta doon sa drain. So drain na din yan siya. So pag dinala yan outside, I mean from OR to the back to room, so usually may bright red na blood na yan sa loob, kasi hinahatak nga niya yung fluid, doon sa may surgical site, sa may surgical site. That is yung use ng inyong Jackson Pratt. So when to report it, so pag drainage, okay, always have to remember, pag dito sa sa breast, so pag drainage, okay, so color kasi problema, nagka-mix na. So yung drainage is you have to report, okay, so report a drain, report to whom? To your to the doctors, to the healthcare provider, if there is a presence of over 100 ml of bright red na blood, of bright, yan, like to the bright red, okay, so na in coloration, okay, so ganun yan na. So you have to report it immediately if there is more than more than, okay, more than 100 ml, okay, of bright red, okay, na fluid. So ano ba yung ibig sabihin kasi? So okay, so within 24 hours post-op, so tatandaan niya, within 24 hours post-op for the, sabihin natin, first 3 days, for the first 2 to 3 days, ganun. So it is actually normal to see a 100 ml per 24 hours na drain sa mastectomy. Okay, so mostly or commonly, 100, within 100 ml per drain. So ganun yun, so sulat ko dito, is normal or usual to see. Sorry, so mga color dito. So is usual to see, yung tinatawag nating it's normal to see yung within 24 hours, okay, within 24 hours post-op 2 to 3 days, 2 to 3 days post-op, a 100 ml drain, okay, drain 100 ml drain for 24 hours, so usually normal, usually normal. Pero what is not normal, sabi nga natin dito, if it is more than 100 ml bright red, okay, so ganun bright red, so sudden, you see the word sudden, okay, see the word sudden, so gawin kong red, okay, if there is a sudden, sige, baba nga ako dito, sorry guys, just gonna use, okay, sabi natin, meron kang sudden, the word sudden is a sudden, it's a sudden increase, so look for that word, it's a sudden increase, increase of blood, of blood. So yun yung mga natin, yun yung mga keywords, so blood of output, okay, so ibig sabihin more than 100, tapos this is accompanied by sabihin natin this is accompanied by fever, it's accompanied by fever, swelling, yan, swelling, redness, okay, you have redness, swelling, redness, and even pain, okay, even pain saan at the surgical site, yan, you have to report it immediately, okay, so don't hesitate to again report it immediately, so report it immediately, okay, so pag meron nito, okay, so report it immediately, okay, report immediately to the healthcare provider kasi this is a problem, so again, normal for the first 2 to 3 days, 24 hours, every a drain of 100 ml per 24 hours. Pero kahit na within that time frame, if there is a bright red, kasi yung pinag-uusapan natin, Sa bright red color. Yan. Tapos more than 100 any time noon. No, kahit within 2 to 3 days sa post-op. So, you have to inform the healthcare provider. So, again, you have to assess. No, you assess your patient para it's all complete, no? Kasi this means that there is actual bleeding or hemorrhage, no? Pag meron tayong ganyan, ang pinaka problema dyan is yung risk nga niya is for bleeding, no? So yun eh, post-operative bleeding ang ibig sabihin niyan eh. Okay, so wag kakalimutan, kasi again, this is a sign, no? This is actually a sign of a post-operative complication, which is bleeding, no? Complication, which is bleeding. So, ganun yan. Just bleeding. So, ganun ang problema doon. Okay? So, remember that, guys. So, we have a question. Okay. So, a patient post mastectomy of the right breast. The client asks the nurse, when will the drain be removed? What is the best, okay, response, or what is the best nurse's response? So dito, when you are asked about when is the drain removed, it is actually removed if the drain is your drain for 24 hours is less than 25 ml or less during the 24-hour period. So ganun usually ang answer natin sa patient who is asking if kailan tatanggalin tong drain na to. So yun yung sagot natin dito. If the drain, again, okay, so if the drain if the output, no, so yung output of the drain is actually less than 25 ml for 24 hours. So pag ganyan na siya kaliit, no, so definitely tatanggalin na yan ng manggagamot, no. So we have to inform the physician na ganun na lang kababa or kaliit yung drain niya, so we can actually remove it, no? They can actually remove the drain na. Okay, so that's the answer for the patient question, no? Okay, so here are questions again about post mastectomy. Okay, so question. So this is a patient 12 hours, no? This is a patient 12 hours post-op. Okay, patient 12 hours post-op, post mastectomy with axillary lymph node dissection. So the Jackson Pratt drain output is 150 ml of bright red blood in the last 4 hours. So what is the nurse's priority? So yan, siguro madali lang na question yan, di ba? So it's A, encourage early arm exercise on the affected side. B, elevate the arm on pillows. Letter C, it's notify the surgeon immediately. And D, document the findings and continue routine monitoring. So what's your answer? No? So the perfect answer here is you have to notify the surgeon immediately. Okay? Kasi ibig sabihin, when you see a bright red drainage, no, that is always a sign na may active bleeding. Tapos tingnan mo, look guys, no, so you have a 150 ml of drainage within 4 hours. Di ba nga, the normal drain is usually just a less than 100 ml ang ine-expect natin within 24 hours. Pero dito, within 4 hours pa lang, 150 ml na ng drain is already present. Tapos it's bright red blood pa. Now, so you have to immediately call the healthcare provider. So, okay, so magkakalimutan yan. Okay, so next question is which time frame represents a period of highest risk for post-operative hematoma? No? So, formation, hematoma formation following a mastectomy. So, post-operative days 7 to 14, the first 24 to 48 hours, yan. You have your post-operative days 3 to 6 days after, or after drain removal usually lasts at day 21, no? So what's the correct answer? Okay, so the correct answer is the first 24 to 48 hours, no? So this is the great this is where the highest risk for post-operative hematoma to happen. So kasi again, most hematomas occur 80% of them, 80% of them usually occurs in post-op, the day 0 part, no, day 0, that is just the post-op, and the following day, or the day 1 post-op. So it's actually 24 hours to 48 hours. So this is the higher risk. So you have to check the site, no, regularly, no, especially doon sa armpit, no, doon sa armpit, doon sa side na yan, no. So you have to check it for hematoma, for presence of a worsening hematoma. Lumalaki yan, mafe-feel mo yan, and nagdi-discolor yan, nagiging purple, may coloration, discoloration yan, no. So you have to watch for that sign. Okay, so the next question is, a patient is 36 hours post mastectomy. The nurse notes sudden swelling of the breast flap, no, bruising, and increased bright red drainage of 120 ml in 2 hours. Which nursing action has the highest priority? So A, is it apply ice to the surgical site? B, assess the vital signs and report findings to the healthcare provider? C, initiate shoulder range of motion exercises? And D, increase oral fluid intake to prevent hypotension. Okay, so the correct answer here will be, again, letter B, to call your healthcare provider, or to inform your healthcare provider immediately. Pero again, you always have to assess first, no? You have to assess. You have to check for the vital signs, so that when you call your healthcare provider, so a complete information about the patient and the patient's condition at that point in time, or this point in time, will be accurate, no? So the doctor will have a clear picture of what is the condition of the patient at the very moment. So that's the correct answer. Okay, so we have another question. So meron pa, we have another question. So here, so meron pa tayo. Okay, so we still have one now. So you have patient, okay, when monitoring a Jackson Pratt drain, okay, output post mastectomy, which findings requires immediate intervention within the first 48 hours? So ano yan? 80 ml A, 80 ml of serosanguinous fluid over 8 hours. Okay. 200 ml of bright red blood over 6 hours. Letter C, 50 ml of straw-colored fluid over 8 hours. Or a gradual decrease from 120 ml to 60 ml over 24 hours. So again, when monitoring your Jackson protein output post-mastectomy, which finding requires immediate intervention? Okay, sino dyan yung feeling nyo malala? So, your correct answer is my correct answer o 2. So, it's 200 ml of bright red blood over 6 hours. Kasi, diba sabi natin, we only expect 100 within 24 hours for the first 24 hours. Eh, minsan nga, Jackson Pratt is removed within the day. No? Pero ito, tingnan mo, it's just 6 hours post-op. Then, meron ka ng 200 ml of bright red blood. So, that is what you find most concerning. So, you have to inform your healthcare provider immediately. Okay? So, the next question is, a patient is 24 hours again post-mastectomy. Which assessment finding most indicates the need for priority intervention related to the bleeding? So, anong answer dito? Patient able to perform gentle hand and elbow exercises. Letter B, drain output. Change from dark red to pinkish serous fluid. A sudden severe pain at the surgical site with tense swelling. Or letter D, mild ecchymosis around the incision site. So, what's the answer? Again, your answer is the perfect answer. It's letter C. So, sudden severe pain at the surgical site. So, again guys, this is a sudden severe pain at the surgical site with tense swelling is actually a classic sign or a hallmark sign of a worsening hematoma. So again, you have to report that to your healthcare provider immediately. So assess, then report to the healthcare provider immediately. Okay? So that is for your post-mastectomy. Okay? So I'm gonna upload the continuation. I'm gonna do the continuation after this. So I'm just going to upload this now kasi it's already 1 hour yung 1 hour yung recording, so medyo matatagalan to upload. So thank you guys for listening. So you wait for the part 2. Okay, thank you very much. So again guys, please support the channel so you can like, share and subscribe. So we can continue doing this to support you, our future nurses, and for your future endeavors. So thank you very much. So ayan, so spread the good news, and the most important is to read and read and read, repeat. Okay, kasi sabi ko nga sa inyo, ako di ako magsasawa to repeat it all over again. So thank you very much guys.